Daily feeding tip. How do we identify the cause of picky eating in our clinical evaluation of feeding, eating, and swallowing? In like just 1 minute, I'm going to break it apart for you into its most simplest bits. Here we go. So in our clinical evaluation of feeding, eating, and swallowing, we're utilizing the Pediatric Feeding Framework to structure all the aspects of eating and feeding and swallowing that we're looking at. So that framework asks us to consider, what are the child's mealtime routines? It asks us to consider, what is their postural control when they're eating? What are the behaviors? This one's often going to be the easiest one to see because that's probably why the child's coming for a feeding eval in the first place, right? The parent's concerned that they're not eating the variety of foods. We're also going to look at their sensory processing skills, specifically how that relates to their engagement with foods. Are they smell sensitive? Can they accept different types of textures of foods? Are they able to sit and participate in sitting at the table, and does that feel comfortable to them? But the most important part of this framework is we're going to make sure that we look at the oral motor skills actively, passively, and functionally, meaning how far do the muscles move, how do they coordinate, and then how do they apply using the abilities that they have with their muscles when they're actually doing the tasks of blowing, sucking, chewing, drinking, spitting, breathing, etc. And there could be lots of different answers for different kids. But by checking all the boxes, we can come up with a meaningful why in our evaluation. Thanks for watching. If you enjoyed today's daily feeding tip, be sure to click subscribe below to join the Peds Feeding Tribe YouTube channel to get more content just like this and hear all my daily feeding tips.